Good evening, Endometriosis Summit crowd, and welcome to a very special and heartfelt Endo Summit Live. This marks the beginning of National Infertility Awareness Week. I am Dr. Sallie Sarrel, your pelvic physical therapist, and I guess lady in charge for today. Please welcome my guests for this evening. First up is Jennifer Gamper Meenan. Jennifer, do you want to introduce yourself and maybe tell everybody how we know each other?
So we went to high school together way back when. We won't give dates and when that was.
Oh, no.
But a long time ago. I work in the world of infertility. I'm a director of mental health for one of the large infertility clinics. I also have a private practice. I was initially a nurse in the field, actually, way back when, and went back to graduate school and got back into the field of reproductive medicine as a mental health provider back in 2000. I don't want to date myself. And I've been in the field ever since. So I'm here to help today support talking about the infertility journey that many of our patients that are joining us tonight have been on or might be going on.
It is awesome to have you here. And again, one of our goals is to have lots of different people and not the same old names. So when I had the opportunity, I've been holding Jennifer Gamper Meenan in my pocket for a little while, and then I finally pulled the trigger. Jennifer, what state do you practice in? And do you do any, I always like to know if people do telehealth so that our crowd can reach you.
I absolutely do. I practice in the state of New Jersey. I do telehealth right now, and it's interesting because I originally was totally against it, and then the pandemic hit, and now I see the need for it, and I think it's allowing us to open up our horizons and meet so many people in different ways, right? I get to meet all of you lovely ladies because of Zoom and all of these different versions of telehealth and meetings. So yes, I am seeing patients anywhere. You can find me. My website is jgmcounseling.com, and you can find me there and reach out.
That's awesome. And yes, we love the hybrid Zoom computer component for those with endometriosis and infertility, because not everybody wants to get out of bed or consistency. And just as we did a bid to go and do a hybrid conference next March. So we're March 4th, 5th, and 6th next year. And I hope the bid gets accepted, because then we could have lots of fun in our undisclosed location, which will not be Hoboken. So, shh. Please also welcome for this wonderful seminar, Casey Berna. Casey is the scientific director of our reproductive immunology and fertility conference from this year, from this past year, 2020. And Casey works both in the endometriosis and the infertility space. Casey, can you introduce yourself?
Absolutely. I'm so grateful to be here this evening and grateful to be here with you ladies. I am a social worker, and I have done private practice like in the past with infertility patients, endometriosis patients, and patients who have suffered pregnancy loss. I also am a patient myself and have dealt with all of those things. Now I'm doing advocacy work and working to try and update standards of care for endometriosis and bring awareness and education to the greater community. And I also run a support group in North Carolina for patients.
Can you share that? I believe it's coming up really soon, or did we miss it? Can you share about your support group?
Sure, absolutely. It's virtual for now in the times of COVID. And actually, we have had some Virginia residents sneak on in because we are virtual. So I have a feeling we'll be doing hybrid as well, because I have a strong local group, and I also have some people who it would be very hard to get here once a month. So we do it the third Saturday of every month from 10 to 11, and it's over Zoom for now.
Wonderful. I can't wait for people to just flock to you. Please give a great big round of applause, claps for my next guest. Please welcome Sandra Elidor. Sandra Elidor owns Filling Empty Wombs. Can you please introduce yourself to this evening?
Absolutely. Hello, everyone. My name is Sandra Elidor. I am the founder of Filling Empty Wombs, where we would love and cherish and hope that we can fill you up with baby, but our main goal is to fill you up with purpose in the process of babies. So we're here to help, and we provide infertility support as well as hopefully we'll be able to fund in different areas of infertility during, before, and after.
Right. So we're going to talk all about that as we get further on tonight, because you have an amazing campaign in the works. I'd like to begin just, Sandra, how did you come to work in infertility, and what drew you to this as your purpose?
What drew me was my own story with infertility. I suffered from endometriosis for 21 years, and the fact that no one listened to me, no one was advocating for me in the medical department and personal at home, because it was unfamiliar to anyone around us. So because of that weight, I had infertility issues because of my endometriosis. And because I was driven by almost, because I was mad. I was sad that I had to go through that process and end up having infertility issues. So that's one of my driving forces. I'm like, I don't want anyone else to go through this, because there was no need for me to land to this point. It could have been prevented if someone listened to me or give me some kind of standard of care during that time, that now I wouldn't have to go through IVF to get my miracle babies.
Wonderful. And Jennifer, what drew you to working in infertility?
So it's interesting. I started out, like I was saying before, as a nurse in the field. And I decided after being a nurse for a while that I felt like so much of what I did as a nurse was counseling and offering emotional support to my patients. And so I decided to go back and get my master's in social work. I felt like there was such a need for it, to have this educational piece and understand where patients were coming from emotionally. I think a lot of our nurses that work in the field have a level of empathy. And so I took that and I decided that I was going to do more with that, and got my master's in social work. And then fast forward, I ended up experiencing my own secondary infertility, which is interesting because I was in the field for so long, even before I found out that I was going to have infertility issues myself. And then obviously stayed in the field and continued to support patients after my own journey. But I ended up just sort of getting involved in fertility even as a nurse, just because I was looking for jobs, and I had worked in pediatrics, and someone said, oh, what about working in women's health? And I thought, oh, that's interesting. You know, there's such a need for it. Infertility at the time, IVF was just kind of starting. It was a very different world back in the 90s, and that intrigued me, learning about that and trying to, I might know I'm dating myself, right, Sallie?
I know you promised not to say when we graduated.
I didn't say when we graduated, but it was somewhere around the 90s, good old 90s. And so that's how I got involved. And now I see there's such a need for it, the emotional support. We're busier now than we've ever been. And I'm sure the other social workers and therapists can agree with me. Like now is we're seeing it more and more. And I think there's a positive in that, is that women and couples are reaching out for more support now, I think, than they've ever been before. And I think there's really a need for it. And so it's been my passion ever since.
Wonderful. And Casey, what brought you to work in infertility?
Absolutely. Well, I went to a social work school, and I worked with other populations for a few years. And then I started to have issues with fertility, and my health started to decline. I would eventually find out that I had endometriosis, and would start the road of multiple fertility treatments and pregnancy losses. And like many endometriosis patients, I know Sandra talked about it as well. Just, it took me so long to get the care I needed, and had I known differently, had been educated, I think my road and path would have been a lot less challenging. And once I was a patient, I realized that, there is a great need for social work. There is a great need for further support. So once I was done with my journey, I decided to use my social work skills in the field of endometriosis and infertility and pregnancy loss.
Wonderful. So many people may or may not know, I had my own infertility journey, which really came about by multiple factors, but one was surgery gone wrong in which they took an ovary, and then in response to the trauma, the other ovary shut down, which according to Dr. Vidali is not an uncommon thing. And then all of a sudden I was 38, alone and not dating anyone, single, doing egg freezing, paying for egg freezing, and still very ill at that time. And actually they tore my labrum while they were trying to get eggs out, which we can talk about that from a PT perspective. The fertility community, their stirrups are different than the surgical community. And I see a lot of people who had that happen. So then my stress relief of going and working out was gone. And what I said today when we ran our clubhouse room was, no matter, and I did a lot of counseling. I'm a very big fan of fertility counseling, but you sort of put it in a suitcase and you pack it away until something happens and life changes, and then everything comes back to the surface again. So of course, when you say goodbye to a parent and you realize that you're going to be it, and this is going to be it on earth, for you, and there is no one else, and of course they didn't have a legacy of you having a child either, it becomes really hard. So in preparation for National Infertility Awareness Week, I have some questions, but Sandra, I wonder how long you endured infertility before someone mentioned the word endometriosis to you, and in what context endometriosis was mentioned in.
Well, for me, I found out I had endometriosis through the medication Clomid. And when we got it to try to have children, we already waited a year now. So now the doctor decided, okay, let's try different interventions to see if it works. Well, the Clomid caused more pain for me. And I would call the doctor, I'm like, is this pain normal? She's like, you shouldn't have any pain. So, okay, let's wait for another month. Did the second one, I was in even more pain to the point I couldn't walk. So we did the ultrasound and find out I had a cyst. Because of that, and I know there's misconception with Clomid, I actually love Clomid because that actually helped my diagnosis. That allowed the doctor to go get further testing and find out you have a chocolate cyst the size of a grapefruit.
Wow.
And we have stage 4 endometriosis. We were going to remove your right tube, and the left tube, the only reason we didn't remove it because of too much bleeding. So thank God, because that actually helped later on, but that happened so fast. It was one thing out of the other, and immediately the only way to get pregnant is through IVF. So it all happened a very short time frame once they told me I had endometriosis. So it's not, you couldn't have time to really process it because I'm just finding out about endometriosis. No one in my family has it. It's not something that I'm familiar with. And you're also telling me I have infertility issues. So I felt like I was hit with 2 whammies at one time. And how do I process that mentally? So in the beginning, I'm like, I'm opposed to IVF. I don't want to go infertility. I'm playing God. I'm doing this. I don't want it. It's not until I started talking to other people and pastors and realized, oh, there's nothing wrong with going through this route. There's not a problem. I'm not playing God. God provides scientists and all that. I'm not doing that. So once I start educating myself in the process, it became a little bit more apparent to me that this is actually not a bad route because of that stigma, especially in African-American community. We don't do that. That's not something we do. But in reality, if you want your children, either way, whatever the process is, you're still going to be a parent. You're still going to have the parenting role. You're still going to go through all the ups and downs of parenting, and you're going to love that child regardless. So I was happy that IVF was an option for me. So my husband and I took it, and now we have our 7-year-old.
I think what's sort of what you were saying, Sandra, I think for so many women, the problem is it's like go, go, go. They don't have time to mourn the loss of this not being the way that they envisioned they'd start a family, and
Right.
sort of being able to sit with that sadness and sort of process it. It's like, okay, next thing, surgery. Okay, next thing, let's get your IVF date. Like, you don't have time to kind of sit in that moment, going back to sort of that trauma. a lot of women will talk about it was this trauma. Like I had blinders on. I just kept going and going and going, and it never had time until maybe after the cycle is over. Or even sometimes women, when they're pregnant, finally are dealing with the trauma of fertility treatment because they didn't have time to sit with it and be like, okay, let me process this. Let me think about how I feel. Am I okay with doing IVF? Because there's such a pressure that once they find that information out, it's like, start tomorrow.
Yeah.
Especially with endometriosis, right? Like we see it, a link with egg quality and, you know, AMH levels, FSH levels and things like that. And so patients feel this ultimate pressure then to have to move forward right away, you know?
Afraid of the pain coming back.
Oh yeah. Once they cleaned everything out and it was good, it's like, now we got to hurry up and get you pregnant. Yeah.
But then if like, I'm going to start this all over again if I don't hurry up and get pregnant. So yeah.
Casey, how far along in your fertility treatments were you before you heard the word endometriosis?
Well, I feel like I had symptoms of endometriosis for years, you know, so my symptoms of endometriosis really started when I was a teenager. And so many doctors had dismissed me or diagnosed me with anxiety or irritable bowel, like so many other patients I know also go through this. And, you know, we had tried on our own for a little bit, and I fibbed to my gynecologist. This is my gynecologist who told me that I had a low pain tolerance. And that's why, you know, I was like, I'm in so much pain with my period every month. And she's like, I think you just have a low pain tolerance. So I didn't really have a great relationship with her. And I kind of suspected that my mom had several miscarriages between me and my brother. There's 8 years difference. And I just knew I wasn't physically well, but I was also young. I was like 25, 26 at the time. And I was worried that they weren't going to refer me, even though I sort of had in my gut feeling like that I knew something was going on. So I actually, and I think I had to sort of try for a year, right? Like to, you know, using the ovulation kits and everything. But I had been off birth control for a couple of years and nothing had happened. And I was just feeling worse and worse. So I went in and my doctor's like, you're so young, like you just need to relax. And she's like, I mean, how long have you been trying? And it had been technically 6 months, like that we had been doing the ovulation, but I told her a year, which like probably, I mean, but I did it. And you know what? I got a referral and I went through all the tests and my doctor was basically like, you know, everything looks great. My husband went through the test. You look great. Everything looks fine. Meanwhile, Hattie just asked, you know, are you having stomach issues? Are you having painful intercourse? Are you having bladder issues? I had all of the signs of endometriosis. But after many tests that had come back negative, he said, you know, maybe you have endometriosis. Maybe we should go in and check. And when he went in and checked, he just said that I had a little bit of endometriosis. He cleaned it up fine. And that we should be able to get pregnant naturally. And it was not going to be an issue. So, and that didn't happen. You know, we went through more fertility treatments and I'm very grateful. I was able to get pregnant with my daughter, who's now 13, believe it or not. Yeah, so she, you know, she was a preemie, she came early. And then I went through further, you know, treatments. I was diagnosed with, not only did I have more than just a little bit of endometriosis, I had a genetic issue with my eggs, a balanced translocation. I went on to have adenomyosis. I had fibroids. So I don't know. I feel like my RE kind of missed a lot, you know.
Yeah.
Of course, I do know, or we wouldn't be here, right? If they weren't missing. So I'm curious if anyone in our crowd has experienced a miscarriage and if they want to share anything about what the miscarriage felt like. I don't want to direct a question. I just want to invite anyone who wants to share. And that's okay. Nobody, you know, it's a public forum. And I said the same thing this afternoon is that we're not forcing anybody to share anything. I don't
mind sharing. I just didn't want to I wanted to give the floor to does anyone else want to talk about it before I start
No, go
talking
ahead.
again?
Go ahead, Casey.
Okay. I have a balanced translocation, which is a genetic issue with really the majority of my eggs, and it causes recurrent pregnancy loss. So I think I've been through 6 miscarriages, and what it feels like, I can remember, and I don't know, maybe Sallie, you can talk to this as well. For me, they were not only emotionally grueling and emotionally devastating, but as an endometriosis patient, as a adenomyosis patient, as someone who had fibroids, they were also physically painful. And for me, what would often happen is I would have to sort of, I'd find out I was pregnant, and then we'd have to keep going for monitoring, kind of knowing that it was most likely not gonna turn out well. So for a lot of my pregnancies, I would just have to wait like a week to 10 days, just sort of waiting for the numbers to go down, knowing I was eventually going to miscarry. And it was a really devastating experience, but also physically painful. And I can remember calling my doctor and saying, like, something must be wrong. I'm bleeding a lot. I'm in so much pain. And we know endometriosis patients, we have a really high pain tolerance. And he's like, oh, you shouldn't be in that much pain. Like, nothing's wrong. I think you're just acting like emotional. He didn't say it in those words, but that's what it felt like. So it feels pretty terrible to have a miscarriage. It's really sad, and it was also physically taxing.
Thank you for sharing. I think also one of the reasons, so for anyone who does not know it, the Endometriosis Summit is co-owned by Dr. Vidali. Dr. Vidali took over Jeffrey Braverman's reproductive immunology practice when Dr. Braverman passed. And now this makes Dr. Vidali one of the leading reproductive immunologists in the country. And everybody always says, but why the endometriosis surgery and reproductive immunology? And the story is he couldn't take it anymore because he couldn't just watch people do IVF and IVF and IVF and not have the endometriosis properly excised and dealt with. And then the other part of it was the trauma of the patients that come in with miscarriage after miscarriage after miscarriage really drives that reproductive immunology component of the practice. And I can say, for everybody that I've spoken with that's miscarried and everything that I've experienced, the grief of you, not only when you're infertile, grieve what you wanted in life, but you grieve what you've lost when you've tried so hard. And you also grieve your bank account, and you also grieve that what could be the addition to your family. And there's a grief to being spoken to like you're a crazy person. Sandra, I wonder if just in general, you could talk about grief within the infertility community.
The grief is very real, but I don't think a lot of people make the two connected to. So they just associate it, oh, that's just part of the process. Yes, it's part of the process, but we need to call it what it is. This is grief. This is mental health. And I strongly believe every practice should have a mental health component associated with infertility, because it's more so mental than anything else. And even when you're dealing with infertility, if you're not mentally there, there's a chance that this treatment may not even work. So I think the mental part is present, and we need to start having more of these conversations and recognizing, hey, you've been through this. There is a trauma associated with when your doctor said you are, and what we would think, we hear, you're broken. The doctor didn't say that, but that's what we're going to internalize, that we're broken. When you hear, oh, this IVF did not work again, all that stuff, we're internalizing it, and it's part of the grief, and we're collecting all of that. Until we do that mental cleanup, it will carry over in other ways. And at first we may not recognize it, that you have post-trauma with infertility. It's very real. And I tell people, If you're going through infertility, you have your infertility doctor, you have your acupuncturist, you have your herbalist. Do you have a therapist? That should be part of your whole health, is having a therapist as part of your group of medical professions.
Wonderful. And Jennifer, can you speak a little bit to grief among the fertility crowd?
Yeah, I mean, grief is huge. It's such a huge part of it. It's sort of going back to what Sandra was saying. It's like losing, dealing with the loss of your body not working the way that many other people around you's bodies have worked, right? Your friends are all getting pregnant. Everybody's having this, oh, it just happened once, I wasn't planning in it, right? You're dealing with all of those other things. So you're dealing with the grief and the failure that you feel that your body's not doing all the things that all these other people's bodies can do. You might be experiencing a loss, a miscarriage, like Casey was saying, going through all of those losses. In some cases, some patients are coming through and dealing with the loss of maybe not being able to use their own genetic material, sort of mentioning what you had gone through. And so I think grief is this huge piece for most patients that walk in the door to deal with infertility or come to terms with having to even just step in and make that appointment. I think everybody has some form of grief, and top of that is anxiety and all these other things that come along with this whole grief process. So I think what we started doing where I work is we actually started offering a free counseling session to every patient that walks in the door. And I thought in the beginning, everybody would take us up on the offer. And they didn't. And I was always surprised by that, because I agree with Sandra. I feel like, when you go through fertility, you should have a therapist, this person that you can bounce these ideas off of and talk. And there might be some weeks where you're having an okay week and you don't need to talk to that person. But then there's another week that you might find bad news or get some information that you really need to process. And so I think every patient should join a support group, should consider finding an infertility, therapist. Other therapists are great, but certainly somebody who might deal with the infertility world or, work in women's health might be more helpful. So you're not having to explain all the different procedures you're going through. You can start where you're at and talk about it with them. But I think grief is all around. As soon as you step foot and you pull into the parking lot of the fertility clinic, I think every single patient, and not just women. I mean, I think that for men, there's a huge loss and grief as well. They just might deal with it differently than we do. And I always say that to the patients. A lot of women will say that their husbands aren't grieving. I'm like, they're just grieving differently than us. So we're seeing it with men as well, going through fertility.
Right. For those looking for information on male infertility and the emotional aspects of that, please see Brandon Johnson's YouTube on our YouTube channel, but please connect with Brandon Johnson on Instagram. Casey, it's brandon.therapist, right? I think.
Yep.
Yeah. So, and it's fantastic because I've never seen a therapist connect to male infertility as well as he does. So Casey, does that grief disappear in either yourself or your patients once they hand you the baby? Because I think that's a common misconception that here's the baby and it's all gone.
No, I think, and I know Sandra talked about this and Jennifer too. I think the PTSD and the trauma last, I think, a lifetime, really. And I think for endometriosis patients, it can be doubly hard because I feel like a lot of patients are already grieving a lot. Maybe they've missed things in high school. Maybe they've missed out in college. Maybe they've missed things because of their health with their jobs. And, I think endometriosis patients suffer losses throughout many aspects of their life. And then if they've lost organs, a lot of endometriosis patients, I mean, the list goes on and on. So then if they too then also go through infertility, it's another loss, it's more grief, it's more trauma. And I think it does take a lot of therapy to work through all of this. And I think it's genius to offer patients a free counseling session. But I think we too have to sort of lessen the stigma around mental health support and normalize it as much as possible. And, I think gynecologists should start having mental health counselors in their practice. It just should become the norm from the start, that if you're going through these physical issues, whatever they may be, that mental health can help you. And I think that would help lessen the trauma. But I'm telling you, COVID brought up, I think, kicked up a lot of the stuff from infertility that I went through, just the fear of the worst case scenario happening, the fear of getting sick, the fear of my body, trying to control everything so my body doesn't get sick again. I felt a lot of that during this past year with COVID. And I know it's stemmed back to infertility and endometriosis and all the health issues that we have gone through.
Can I ask a personal question of all of you ladies? So,
Yes, please.
I think this is one of the things that a lot of OBGYNs or doctors that are seeing patients are uncomfortable with bringing up is this idea of providing mental health, right? And I know I deal this with, it's a little different when I work in my private practice versus the infertility clinic I work at, because we have a huge presence. So a lot of the nurses will feel comfortable bringing it up to patients and saying things. But I think for OBGYNs that refer to me, I think some of the concerns they have is when a patient is suffering with severe pain, or they could see that they need the additional support, is, well, how do I bring it up in a way that they don't take offense, saying, oh, here's my endometriosis patient again, and she's, experiencing, this pain. And now I'm going to say to her, oh, I think it'd be really helpful for you to see a therapist. And so that's been a question. So I'm just asking from a personal perspective, if the three of you, if your gynecologist in the beginning had said that to you, how would you have taken it? And, or how could they have said it in a way that you feel like would have been supported and not taken offense to how they were presenting it, if that makes sense?
I'm on all sides of the coin with that, because there are many local GYNs who are not necessarily endometriosis specialists who seem to feel that pelvic physical therapy is something that you do when you don't need to deal with you can't deal with the patient anymore. So I've been on the practitioner side of that. I've been on the patient side of being told basically that I'm crazy and women have pain and I should get over it, that people who menstruate are going to have cramps like this. And I've been on the side of running practices in my first reincarnation, where doctors are using mental health counselors to evaluate the patient so the doctor doesn't get sued, not because it's what's best for the patient. So I've seen all sorts of things. And so would I have been receptive? Probably not as a teenager, but when I showed up in the fertility clinic and the doctor said to me, we offer this for free and you're all alone in this, you're not doing this with a partner. I made the call on the way before I even got to the subway, right? So when I knew that moment, and I will also say that within 24 hours of my mother dying, I was already enrolled in grief counseling. And so I live in a world also where I'm coded with privilege, and I understand that mental health matters, and we don't do a very good job teaching that to people who don't come from my background. But the other thing that we do with the Endometriosis Summit is I am a patient and practitioner entity, and we don't say patient and doctor entity, because we always have a mental health component. We always have a physical therapy component. We always have a nutrition component, because we want to show the world that it is multifaceted. So I'm hoping when we hit our 10th anniversary, God willing, that we'll be accepted. Sandra, what was it like for you to, and I don't know if you did, but if to seek or to ask for mental health, and you're part of a couple, did you need to do it together, and also you don't have to answer if you don't want to?
No, I'm okay with answering. We actually doing it now. And honestly, I wish that's something that we did before in the very beginning, the very first time. It was never mentioned to us. We got, hey, we recommend you see an acupuncture. That was it. And the second time, we recommend you see an acupuncture and a nutritionist. That was it. It wasn't, I think a lot of practitioners forget the delivery. And even if that was offered for me when I went through endometriosis surgery by itself, I probably would be, no, I don't want it. But it's all about the delivery and the packaging. If you told me, hey, this is what's going on, we recommend you see a pelvic floor, we see a nutritionist, you see this, and mental health is also part of that package, then I'm like, okay, I can hear that. I can see, because now we taking a holistic whole body approach versus or you just need to see a pelvic floor therapist. And I think we need to start packaging these deals, bringing everything to completion, because it's not just the physical. It's definitely the mental, and we know even the financial part is there as well. So start packaging the deal so we can work with the individual as a whole person, not just infertility. We need to look at every aspect of infertility.
Wonderful. And Casey, what was it like for you when you decided to go, or I don't even know if you went through fertility counts. I just assume you're a social worker. You go through, you know.
All of us
I don't
social
know.
workers seek therapy.
Right. I just assumed.
I would be horrible if I didn't. Yes, I had a therapist that I loved in college who I, went back to. I went back to during different times of my life where I felt like I needed extra support, and she was fantastic. My husband and I explored embryo donation, which ultimately fell through, but we went for counseling with that, like to talk about it and to explore those options. And then even as a 38, 39-year-old heading into a hysterectomy for my adenomyosis and my fibroids, even though with all of my other fertility issues, my pregnancy losses, I was ready, right? Like my fertility journey was definitely over. I still, I went to counseling because it still had to be dealt with. It had to be talked about. We had to work through it. And I was really grateful that I did.
Yeah, wonderful. I think also, I wish that the infertility community would embrace the counseling just like the first appointment with the fertility specialist, because the counseling helps you move forward. It doesn't brandish you as a bad person. Jennifer, I don't know if you want to comment about how it's recommended.
Yeah, no, I think a lot of patients, like for where I work, we see patients, anybody who's doing third-party reproduction. So whether they're using a donor sperm, egg donor, gestational carrier, they're required to meet with one of us. And that can be really intimidating, thinking, oh, like you had said, Sallie, like some doctors refer so that the mental health provider can sort of assess them. And that's not really our role. We look at it as a psychoeducational session. For those types of consults. So we're educating patients. We're helping them to think about the topics that they need to discuss as a couple or an individual, things to think about. So it's really more of a educational session. And I think a lot of patients are really hesitant about doing it. And then when they come in and they realize, and I always say my first line is, I'm not here to analyze you. That is not my role. My role is to be a support through this whole process. Then you can see people's shoulders sort of loosen and relax. And it's more of a dialogue as to what I tell patients. And we're here to support you through this process. And it's here to be a dialogue and talk about what you're feeling and what you're thinking, and to kind of throw ideas out to you. And then also the counseling page. Yeah, I say the same thing to patients. We're here as a support to help you process this. And sometimes you don't even know what you need, especially when you go in the door for the first time to the fertility clinic. You have no idea. You're like, I always say, you're like a deer in headlights, right? You just kind of stand there and you don't know sometimes what you need or what to ask or where. And so I think a lot of times the therapist can be that voice for you, help navigate you, almost like a navigator in a way. I say to patients, the ones that are scared of going to therapy because they're not sure how they want to talk about things or how they feel. So then look at us as a navigator to help you process this information and figure out, what questions do you ask? What should I be thinking? So sometimes that feels a little less intimidating than going to meet with the mental health team. And we always struggle with that term, because I don't want patients to be scared of us. I want patients to come to us because they could use this support. And I think it's starting to change in the infertility world, I have to say. I think doctors and physicians and other people are starting to see that it's important to have that mental health component. So I hope it continues to change with talks like this and webinars and different things.
Right. So one thing that when I was, doing content for National Infertility Awareness Week, and the Endometriosis Summit is always very sensitive because we talk about pain and quality of life, but some weeks we get to talk about infertility because we know that 40% of people with diagnosed endometriosis have infertility, but we also know that up to 20% of infertility is unexplained. And we would be the first entity to say, are they asking the right questions, right? Casey, I don't think unexplained infertility is so unexplained. Do you have an opinion on that?
Yes.
Yeah, just a little.
Yes, especially after hanging out with Dr. Braver and Dr. Vidali, I feel like they have, very much influenced me in that endometriosis can be asymptomatic. So, patients have endometriosis, it's impacting their fertility, but they don't know, the doctor doesn't know. And a lot of times doctors will just say, we'll fix this with IVF, and, and not really get to the bottom of what's going on. So, although, I also feel like, is it really unexplained? Because if you, like you were saying, if you ask the deep questions of, oh, how often do you have to pee? Or you have stomach issues? Do you have any leg pain? Do you have any back pain? Are you fatigued? I feel like there's such a narrow view of endometriosis by the majority of practitioners that they often will miss it. And then it will be, people will be unexplained. So it's unfortunate.
Yeah, I also think the culture of, first of all, IVF clinics make money doing IVF. And excision is not accessible to all, right? Mm-hmm. So somebody does an ablation on you and quick, better do IVF before it grows back. It's very different than if somebody does an excision and you sort of have time to process how you want to deal with any inflammatory response. But I see now that we're have a little bit of a fertility component, and I follow all the fertility profiles, and it's like a badge of honor. I did 12 rounds. I did, I like first of all, I cherish the person hand over the heart who says, I did 1 round and that's all I could take mentally, because they have honored themselves, right? But I also don't think it's a badge of honor. I did more rounds of IVF than you. I think it's like hey, your doctor should have done a better job. I was reading in preparing content for this, that there have been studies in which people with endometriosis have higher anxiety levels than those with cancer, those who have survived a heart attack, and those who have hypertension. Do you want to talk? I'd love to talk about anxiety, but Sandra, do you want to talk a little bit about anxiety and infertility?
Absolutely. I think that study is true. Honestly, I think it's very valid. And I'm not taking away anybody that has cancer, anybody that has those things, not taking that away, but endometriosis is almost a lifetime for many of us of suffering. It's a lifetime. So unlike cancer, you may have an episode, they come back, but it's a lifetime. And we're talking about, I started my pain, I could remember it as early on at 9 years old. So imagine 9, 10-year-old, every single month, before my menstrual come, I was already hypersensitive. I was already, it's about to come, preparing for the pain before it even gets there. So when it's there, I'm worried about, am I leaking? Am I this? Is this showing? How is this pain level this going to be this time? I'm preparing for the pain before the pain gets there. And as an adult, I'm worried about, what if I do have children? Am I going to be mentally, physically able to take care of them? There's so many ways our mind goes around endometriosis that the anxiety level is there, and it's there even after you have surgery, even after, if you're at a situation that your pain level is good standing. And I'm at that position, but I still worry about, maybe this month is going to come. Okay, this month didn't come. And even when I had my son, I breastfed way longer than I wanted to, only because I didn't want the pain to come back. I didn't want to go through that. So I believe we are full of anxiety when it comes to endometriosis. That mental aspect is definitely there when it comes to endometriosis, because we're preparing for the pain, even if the pain is not there, or if it is.
It is so very true, because I think that component of being told your symptoms aren't real
Mhm.
also makes you prepare for the pain, because you know they're real, but you're trying to cover it up. We normalize that pain. That's why people go, oh, infertility can be unexplained. It's not unexplained if you were true to yourself in any way whatsoever. Casey, do you want to talk a little bit about anxiety and infertility?
Yeah, I mean, I think for endometriosis patients and for fertility patients, I think they're at a greater risk for experiencing anxiety and also depression. I think there's a great feeling of not being in control, like of life, of your body, of your future, of everything being uncertain. And just if you really like think about, I went through probably like 3 or 4 IVFs and, other treatments, and just even like the getting up and going and being monitored, and, like how many drugs and the needles, and, how many follicles do I have? And then, for us, especially with the genetic issues, it was, well, how many embryos did we get? And then every day, like, was how many embryos mated? Were they okay? And then, I mean, it just feels like it never ends. And then, even if you do get pregnant, and especially if you've experienced loss, well, am I going to stay pregnant? Like, how long is this going to last? And, we joke that if we ever had a successful pregnancy again, that I wasn't going to tell our families until the kid graduated college, because you just felt like that anxious about the situation, and then and like I said, it feels like it lingers.
We actually have some comments on Facebook Live comments that, even when they hand you the child, the anxiety doesn't go away. And I think you're living the life that unfolds after the worst case scenario. And so, and you live in that bubble the rest of your life. Jennifer, do you see a lot of anxiety amongst your endometriosis and infertility patients?
Oh, absolutely. I think it goes back to what Casey was saying. It's such a loss of control. You have no idea what's going to happen next, when it's going to happen, the anticipation, if this is going to work or not. And so patients feel like they're spiraling, and at some points I've even said to patients, like, if I could look in a crystal ball and tell you that it's going to be the next cycle and you're not going to have pain, like, wouldn't that ease the anxiety? And patients say, absolutely, because the anticipation of it all, sort of what Sandra was saying, is like, when is it going to feel okay? Am I going to feel all right? If I get pregnant, am I going to have pain during pregnancy, post-delivery? When is it going to start up again? That feeling of not being able to anticipate and plan for what's going to happen is a huge piece of anxiety for most patients. I mean, infertility in general is a loss of control, but I think with endometriosis, it adds definitely to the piece of it all for them.
Yeah, I think Casey could talk to it pretty well, but like with endometriosis, what happens is you go to the doctor for like a million years and you say, hey, I have bloating. And then they go, you must be eating this, or you must have done this, or Sandra talked about leg pain. You have leg pain and you can't walk. And so that you live in this box where I can only eat these 3 foods and then I'll be fine, or I can only, and then your world explodes. Mm-hmm. When you add the infertility component to it. Mm-hmm. Casey, I know you talk about what life was like for you as a teenager before any of the infertility came out. Do you think that whole experience of what we call gaslighting fed the anxiety response when you went through an infertility journey, or fertility journey, whatever we say?
Yes, I mean, I just a mistrust of doctors. Like, it's really bad, like when you can't count on your medical professionals, and you don't feel like they know what's going on with you, or they know what's best for you, or they're telling you the right thing. It really adds another level of drama to the whole situation that really should be quite unnecessary. And I thought my fertility doctor I could trust, right? And then, I come to find out I had extensive endo that needed hours and hours more operation. So I think it just beats the anxiety and the uncertainty of, people telling you certain things that you later find out not to be true about your body. And not only that, but had you found out about these things sooner, and Sandra had mentioned this earlier, that if we found out about these things sooner, then we would have had a better path to greater health and greater fertility. So I think the gaslighting absolutely feeds into the anxiety, for sure.
Now, let's talk about what the financial burden of treatments do to many people's mental health experience with fertility. Jennifer, I'm going to let you begin, because then I want to hear from Sandra, because she has an interesting project about this. But what is that financial burden? And I understand where you practice is not a snapshot of the world, but what is that burden?
Across the board, I think you went back to talking about fertility preservation and freezing your eggs. And I think there is a small group of women that can afford to do that. It's very minimal. I think that I wish we could find some type of organization. I know there's a few organizations now that are starting to pay for fertility preservation. I think that is amazing if you can work for one of those organizations. But I think that's a huge piece, that if you're told at a young age that you have endometriosis and you start educating yourself on that, I think there's not many people that can go about and do fertility preservation. I think that's it. If we can change that, Sandra, sign me up for that, because there's got to be some organization that can help provide that. The second piece is obviously the infertility. Most of it is not covered by insurance. I mean, there's a New Jersey mandate where I am in New Jersey, but even if you look at the mandate, it still doesn't cover a huge majority of it. So patients are already anxious, stressed out, overwhelmed, coming in the door, and then finding out that they have to spend $20,000, $30,000. If they have to go through genetic testing, what Casey was saying, and test embryos, that's even another $5,000 on top of all of that. And so you're looking at a small group of people that can even afford to go through fertility treatment. And that's, if they're lucky to have good insurance. And so I think it's very limiting on who can go through the process, very limiting.
Right. So Sandra, what does Filling Empty Wombs, which is your organization, have to say about the financial burdens, and what kind of but what is your long-term plan there? Let's put it out into the universe and hope it happens.
Let's put it out there. And sorry about my dog, if you guys can hear my dog. But it's hard. Yet alone, you already feel broken. Now you telling me that I have to pay thousands of dollars. We're not talking about a little 2, 3, we're talking about thousands of dollars, medication and the procedure. And that's if you're lucky that the first one takes. So many have to get their life savings, their 401k, their get out loans to pay in hopes of getting that one, at least the one. So that leaves a lot of burden. And especially when you're looking at the minorities that may not have the extra disposable income to do that, or someone that wants to be a mother by choice, single, it may be hard to do that. That's a huge financial burden. So one of the things that we want to, because my family, my husband and I, we had to move away from our home, comfortable home, move in with our parents to try to save, not something that we wanted to do, but our goal was to have a child. So we were willing to do whatever it took. We were able to save that, but that shouldn't be the case. Many people opt to not have treatments early on, not because they don't want to, they just simply can't afford it. So one of the things that our initiative that we want to put out there is we want to fund your infertility, either partial or full. I have a background years ago of event planning, and my plan is to fundraise to be able to give you that check and say, here, expand your family. And we want to go even further, because now you just spent thousands of dollars to get the baby. You may still be making payments when you have the baby. Now you want this baby to go to college. I'm still paying for you that you got here, yet alone college. So that's another thing we want to be able to fund, even for your miracle baby to go to college, because we should not have to deprive and keep finding funds to take care of our children. It should not be the case. And I hate the fact that money is such a big deal here, that we need money for something that should be free. To be honest, that's something I can go and have surgery, get nip tucked here, and my insurance is covered. But something like this, no, we're not going to cover you. But we have penile implants that's being done. We have so many other things that's being done, but we will not cover infertility. And I think that's crazy.
It is totally crazy. It would not be an Endo Summit Live if we did not add this question. Casey, how do you think the current standard of care affects those seeking fertility care?
Well, I mean, for endometriosis patients, not only do they have to try to find the money for fertility preservation or, fertility treatments, excision, which can help patients' fertility, right? That's what research shows, that excision surgery can boost a patient's fertility. That often is not covered. So, and partially why it's not covered is because it's not recognized as a treatment for endometriosis. So, we're pushing along, and we're trying to get ACOG and honestly ASRM also.
ASRM.
The reproductive endocrinologists often do the ablation. The majority of OBGYN providers do ablation and not excision. And it's in the standard of care, although weirdly enough, they do recognize excision for endometriomas, that it's best for fertility. Well, right. So you have to be careful. You have to look at the ovarian reserve, but instead of just draining an endometrioma, they do recommend excision for an endometrioma, obviously with a qualified surgeon, and that's not for everyone, depending on ovarian reserve. But any which case, they do recognize it in some instances. So we're pushing to have excision recognized by everyone, and then hopefully, insurance will recognize it as well and cover it. And I did want to mention too, the Alliance for Fertility Preservation is a great organization that primarily thinks about cancer and started around cancer and preserving fertility for cancer patients. But some of the bills in some of the states also, what they say is that if a patient is going to have a surgery that may damage their fertility, which I feel like endometriosis surgery could maybe be included in that, some of the bills are more vague, and that we think endometriosis patients would have coverage under that fertility preservation. And obviously Resolve and Resolve New England are working very hard to try to get benefits, for everyone. And they've been going state by state too. But, some of the mandates, like Jennifer was saying, cover a little, and it's better than nothing. But I love the idea of having a scholarship, and please send that information our way when you come up with it, because I would love to help support that.
Thank you.
Right. So you mentioned something really important, and that's legislation. And the Endometriosis Summit hasn't started to expand in this area so much, although I have personally, but I think joining with an organization like Resolve New England, when I went to Resolve New England, you can actually sit, that's there. They have a big conference in October, November time, and you can actually go and sit with who lobbied on Capitol Hill and won what bill and what state, and go through and meet all these people who are more than happy to teach you how to do it in your own state. So it can be a tremendous resource to find some of these organizations. As we close out, I want to ask everybody, we'll start with you, Casey, because you're highlighted already. I want to ask you to answer the question that was tonight's topic. What does infertility feel like?
Infertility is a sadness. It's a loss, and it's a sadness. And it's a grief that sticks with you.
Thank you. Sandra, what does infertility feel like?
You know, as soon as you said that question, I'm like, fight the tears, because it's been an emotional day with Infertility Week. But infertility feels like you are in this bubble, like you're by yourself. There's no one that could enter, no one can help you. And the help that you can, or maybe roll to get the help, you're still blocked. You're still in that bubble, even when you're going to the doctor, because some doctors make you feel like a number. You feel like I am just another check of you getting, oh, I did a win today, or I did a procedure. But we're still left rolling back home and still feeling empty. And I don't want that. I don't like that feeling. We should not feel this way, especially when we already feeling guilt on our own, because we're always left wondering, why me? Why am I broken? Why is everyone around me are able to have children, even if they didn't want them? Or people that are abusing children, why are they get the option, but I did not? So we already feeling this way. So when we do go and roll to the next appointment and that doctor doesn't give us that necessary, even if it's just that extra, I hear you today, I see you. Sometimes we don't even require much. It's just we want that empathy. We want to feel that every single dollar that we're paying, especially out of pocket, is being used to fully care for us. And sometimes it's the price does not match the care. It does not match, and it needs to, regardless if it was free or the crazy amount that we're paying. We want to be heard, we want to feel secure, and that therapy part will make us feel that, but we just don't want to feel broken anymore.
Beautiful, beautiful. And Jennifer, I'd like you to share, what does infertility feel like?
I think that the word is exhausting. I think it is exhausting financially, emotionally, physically, and very defeating for a lot of people. But I just think of exhausting. That's the first word that comes to mind when I think of going through fertility treatment in every way possible. Getting up in the morning, going for those early morning appointments, having to give yourself the injections, having to write, put your credit card down for another bill. So I think at the end of the day, many people going through it are just exhausted, everything, emotionally, physically, financially.
Very true. I think that, and infertility is the death of all of what you imagined your life would be. And it is a grief and a loss of all the what ifs and when I grow up. And I also say, as someone who founded now what is one of the largest endometriosis entities in the world, from the ashes rises the phoenix. And we are here for all who experience that. So Casey, where can people reach you if they would like to?
You can find me on Instagram at Endo Social Worker, or I'm on Twitter at Chances Are. That was the first Twitter account I started, like, I don't know, 10 years ago when I was going through it. And CaseyBerna.com. You can also go there.
Wonderful. And you're still offering coaching sessions?
Yes. But definitely doing the support group more, but people can reach out to me anytime if they have questions. If they go to my website, you could watch the video you were in, Sallie, like I have a video on mental health, endotruths, mental health, endometriosis, and infertility.
So true story. That's what's known in Judaism, the shidduch between Dr. Vidali and I. That's how we met. And then led to the forming of the Endometriosis Summit. Sandra, how can people reach you?
You can reach me on all platforms, either under my name, Sandra Elidor, or Filling Empty Wounds. We will have our website up soon. It will be both fillingemptywomb.com and fillingemptywomb.org. So, and then there's Clubhouse. You can always find me there as well.
Oh, tell everybody when your room is, because it's an amazing experience.
My club on Monday nights at 7:00. Every Monday night we have our support group. And if we have any other topics that we want to have, maybe a group of people, we usually often do it on a different night, because we want the support group to be just that, just focused. If you want to share your story, if you have that moment that this week is just too much, you're able to share in that space. We have catered or curated topics, but I will put that aside if someone comes up and said, I need support today. And that's the first thing on Monday nights. That's all about support.
Wonderful. And Jennifer, how can people reach you?
So I'm not as fancy on Twitter or anything like that. I'm so bad with technology, which is dating us. But you can meet me or find me on my email and website address, which is jgmcounseling.com.
That's wonderful. So don't tech date all of us, because you can find the Endometriosis Summit on YouTube, Facebook, LinkedIn, and on Clubhouse. We are on Clubhouse Mondays at 1 p.m. Eastern Standard Time, and we talk all topics endometriosis. And we're also entering the podcast. We're going to take these webinars and just put the audio on Apple iTunes, because the goal is to reach more people. The goal is to make sure that no one suffers out there in the dark and in alone. So if they can see it on YouTube, great. If they can listen to it on Apple iTunes, great. If we can reach them by meeting them, and that's what we want to do. So thank you for joining me. We'll be back at you soon. If you have any questions, comments, or concerns, please reach out to me at Endometriosis Summit or theendometriosissummit.com, and we'll try to help you out. Take care, everybody. Good night.
Thanks for having me. Bye.
Thanks for having me.